There's nothing else I could do but to cough.
Environmental pollution not only destructed the nature, but also caused onset of various diseases. Asthma is one of them. People with habitual cough without the bronchitis or lung disorder are on the rise. This edition of Oriental Medical Digest will examine the problems associated with asthma.
When the dust particles, carbon monoxide, and sulfuric gas enters the respiratory tract, they attach to the bronchial tubes and cause inflammation. This inflammation leads to the narrowing of the bronchial tubes and eventually leading to asthma. Asthma patients usually complain stuffy chest, phlegm discharge, shortness of breath, and heavy coughs. Symptoms worsen after the sunset, especially during a sleep.
전적으로 기관이 약하신 분들이나 또는 그 기관지 자체가 민감하신 분들이
Some
있고요.
are born with congenitally weak bronchus. Smokers and patients who suffer tuberculosis, pneumonia, and chronic cough have a higher chance of having asthma.
결핵 또는 폐렴, 또 심한 홍역, 백일해 이런 질환을 앓은 분들이 주로 기관지 천식에 잘 이완이 됩니다.
Paul's diagnosis in Oriental medicine uses 3 fingers to determine the pulses on both wrists. Index finger checks on the condition of heart and lung, middle finger checks the condition of stomach and liver, and ring finger checks the condition of kidneys. Pulse of asthma patients tends to be slightly rapid. Another is computer-mediated diagnostic tool to determine the condition of 12 major meridians of the body. This diagnosis technique is effective for determining the disequilibrium of respective organs, which can be detected by the biochemical analysis. Healthy person's graph will show a relatively steady line, while abrupt changes indicate problems for the particular meridian. One of the ways to treat asthma includes an acupuncture treatment. Acupuncture invisible energy known as qi, or life force, flows within the meridian. When the flow of qi is obstructed, a disposable acupuncture needle is inserted to invigorate the circulation of qi. Human body possesses many meridians, and each meridian has a trigger points where the energy can enter or exit. These entry or exit points are known as the acupuncture or trigger points, and the human body has approximately 361 points. Since asthma is closely tied with pulmonary symptom, acupuncture points are selected on the lung meridians.
This point is Zhengcheng, located 1 centimeter bilateral to the 7th cervical vertebra. Very useful point for asthma and dyspnea. Bisu, located 3 centimeters bilateral to the 3rd thoracic vertebrae, has a function to relax the constricted bronchus. Shimsu, located 3 centimeters bilateral to the 5th thoracic vertebra, can relieve the stress on the heart from prolonged dyspnea.
This is typical Oriental medicine pharmacy with numerous herbs. Pharmacists here are preparing a prescription specific for each patient. Gilgyong is widely given to asthma patients. Gilgyong is known to help dissolve and expectorate the phlegm. Normal dosage is 4 grams. Omija protects the lung energy, and it has very sour taste. Normal dosage is 4 grams. Menmundong and sasam moisturize dried respiratory tract. Normal dosage of 4 grams may be reduced to suit one's preference. All these herbs are decocted together for 2 to 3 hours. All the process is done in sophisticated way and taken according to the doctor's prescription. Herbal extract is packaged into a vacuum-sealed pack for an easier consumption. Herbal remnants makes an excellent fertilizer.
More than 64,000 Americans die from the complications of dust pollution per year. These minute dust particles hinder the respiratory function and immune system, eventually affecting the cardiovascular system. Oriental medicine has an inhalation therapy to enhance the respiration. Let's see how it is done.
This is a spraying instrument which is applied directly on the respiratory tract to treat the asthma. The essence oil is called lavender, extracted from perilla leaves. Perilla oil is sprayed around the mouth, and the patient inhales for 5 seconds and exhales for 10 seconds.
Lavender works by expanding the respiratory tract and promote easy expectoration of the phlegm.
Asthma is one of the most difficult diseases to treat. It's important for the patients to have enough confidence in the cure and frequently consult with an easily accessible physician. Nonetheless, smoking must be strictly prohibited, and even slight cold symptoms must be dealt with extreme caution.
Coughing is body's natural reaction to expel the impurities accumulated in the respiratory tract and bronchus. For the asthma patient, the goal of the treatment should be focused on removing the cause, not just to suppress coughing. Knowing if the patient is allergic to a particular substance also helps in diagnosis and treatment.